Hello, and thank you for joining us for another episode of Matters of the Heart, brought to you by Pentucket Medical Cardiology, as well as Haverhill Community Television. My name is Dr. Srivastava. I'm a clinical cardiologist at Pentucket Medical here in Haverhill, and I'm joined today by one of my colleagues, Dr. Seth Bilazarian, an interventional cardiologist. And we're going to talk about something that's a timely issue or a seasonal issue, and we're going to talk about how to protect your heart in the summer months or in the heat. We've in the past done shows or a show looking at cold weather issues and how to be safe with regards to your heart when shoveling and doing other things. And so today we're going to switch gears and talk about how to be safe in the heat. So with that, I will hand it over to Dr. Bilazarian.
Great. Well, thanks for the introduction, and interested in hearing your both personal and professional perspective on this. But I think as cardiologists, deal with different issues in summertime versus wintertime. Of course, the wintertime we deal with flu and many of the consequences related to those kinds of winter issues and heart attacks with shoveling, as you already alluded to. But in the summer, we don't see any heart attacks from shoveling. But there are other health issues that are common, some heart-related, some not heart-related, but I thought we would cover them. But I think most people think of the summer in a very positive way. I think many of our patients think winter is bad and summer is good, and I think a lot of the goodness about summer is around the fun things that people do in summertime with fun times at the beach or pool or barbecues or picnics or sports or other outdoor activities. So we're hoping to cover some tips and ideas about things to be mindful of in that regard. Summer has a lot of good aspects to it, but there's also some not so good stuff. There's so-called, some people describe it as the dark side of the summer. Some of the summertime issues, of course, relate to the sun being the prominent part of what makes summer what it is the warmth and the brightness of summer. So we'll mention a little bit about skin cancer and remind people about the safety issues of insect bites and poison ivy. There's not to be a killjoy, it sounds like a bad list, but foodborne illnesses when people go to barbecues, leaving the potato salad out in the sun, not a good idea. There's issues with swimming and drowning, of course, sunburns and other kinds of issues. There's a variety of issues that I think is worth just taking a moment to talk about and reminding our audience and our patients and ourselves, of course, for us to remind our patients and others about ways to limit or reduce the amount of injury or inconvenience or even death related to summertime issues. I am a poison ivy sufferer. I get poison ivy every summer from my dog and suffer from it. And some strategies are out there to try to minimize that. I'm not successful, but I have been better about it.
So some of these things you outline are not necessarily heart patient specific, but maybe we'll start off talking about heart patients, and you can talk about some tips for heart patients and how they should approach the summer.
So if you're a heart patient or certainly a patient over 50, one of the things that we worry about are the implication or the stress that significant heat can put on the heart in summer months. So one of the things that we know is that we all learned in biology when we were in 5th grade that we're warm-blooded, to use that expression. We're not cold-blooded. Animals that are fish and snakes, they change their temperature with the temperature of their environment. So when it gets cold in the water, a fish's body temperature goes down. But for us, when we are in warm weather, our bodies do everything it can to really strictly regulate the temperature around 98.6 degrees. That's the normal body temperature. So that's an important issue for health for us, and the body has to really work to do that. So sweating and trying to stay cool are strategies that actually take a lot of work for our body, a lot of energy, and our body does that as a strategy to try to achieve cooling. One of the things that can happen, though, as we get older, it actually becomes more difficult to regulate temperature, and our body temperatures can rise, and a variety of things that can happen. But some of the medicines that are used, like blood pressure medicines, can actually make it more difficult to regulate body temperature.
Such as what?
So almost all the blood pressure medicines can make it difficult to regulate body temperature. Beta blockers, medicines that inhibit our body's ability to go faster, heart to race. The medicines in the ACE inhibitor class or diuretics or calcium channel blockers are all been said to can make it more difficult for us to respond to heat or our body's response to heat. So those are issues that if people are on blood pressure medicines, I would say just generically on blood pressure medicines, they should maybe be extra cautious about being careful about the issues that come around with heat issues. So I would say, though, but even people who are not on those medications but are older, the issues that can happen with regulating regulating temperature can be significantly problematic. So I think that the basic message that if you are in a hot temperature situation, do your best to try to stay cool, try to stay hydrated, drinking fluids to make sure that your thirst is quenched. But one of the things that's concerning for people on medicines or older patients is that they may not even be aware that their body's getting hotter, and they may also not be aware that they're thirsty. Sometimes these things can be problematic for people in older age groups and in people who are heart patients or are on heart medication.
Okay. Before we get into some really specific things, maybe you can just go over a few tips to get started for people. And there, I think we're going to talk a little bit about heat stroke or heat exhaustion and things like that.
Yep. So I think that if you are out in the warm weather, trying to limit the amount of time someone is out in the weather while taking breaks. Taking a break to either get into the shade or into air conditioning is wise. So watching the clock and trying to limit it. But I think one of the strong recommendations that's often made, I think is a wise one, is to try to limit the time that you're outdoors between noon and 3 o'clock when the temperature is really hottest. The early afternoon from 12 o'clock to 3 p.m. is really the hottest time of the day and really the most difficult time for our body to regulate temperature because of the sun. The sun is the strongest at that time of day, and the temperature is the hottest. Some of our patients then say, well, therefore, I'm not going to walk at all. For our heart patients, we want them to continue to exercise, but the early morning hours or the late evening hours when the sun is almost set are really good times to walk even on a hot day. So I think that those are wise. Exercising with a friend, as a buddy, to sort of keep an eye on you. You can remind one another about keeping hydrated, about staying cool. That's another important thing. And then there's some simple strategies about wearing the right clothing. Wearing light-colored clothing, wearing fabrics like either cotton or I'm a personal fan of some of these synthetic fabrics that wick sweat away. It's really much cooler to wear these athletic type T-shirts that help wick temperatures away. Same with athletic socks. We sweat in our feet quite a bit. We sweat on our arms, underneath our arms and our chest. So wearing these kinds of fabrics that take the moisture away and help us keep cool are very wise and should be much more comfortable as well. So dressing for the heat with lighter fabrics that are both lightweight and lighter color, because lighter colors reflect the heat. If you wear a black T-shirt in the sun, you're going to be absorbing the rays of the sun. If you're wearing a white T-shirt, you're more likely to be reflecting some of the rays, not all, but reduce the temperature in that regard.
Very good.
And then drinking, of course, is a really important thing. So drinking plenty of fluids is really important strategy. We're going to talk a little bit more in detail about drinking and trying to stay hydrated and some strategies to remember that. I think that those would, I guess, be the important things. One of the cautions about drinking is to really be cautious about using caffeinated beverages for hydration. So when we drink, we want obviously the water to stay in us because we're losing so much water through sweat. And if we drink beverages that are diuretics and cause us to pee more, it's not really a net gain. So common drinks that cause a little bit of a diuresis are beer, alcoholic beverages. So if you're drinking a beer to stay hydrated, that beer is really going to be lost in your urine, so it's not going to be a net gain in that bottle of beer, that 12 ounces.
I know it's a pretty common thing in the summertime. People are barbecues, picnics, beach, etc.,
Right.
and a fair amount of alcohol is usually
Right.
consumed.
So I think that's, I'm not saying that you shouldn't drink beer, enjoy a beer. That's, we think that an alcoholic beverage per day is healthy and wise. So enjoy a beer, but that actually doesn't even count really in your hydration. You'd have to still drink something else, water, whatever. And similarly, caffeinated beverages. Iced coffee is a very popular beverage. It's largely watered down, I think, the way most people drink iced coffee, but some amount of that coffee really is, again, causing a diuresis. I think most people know that after they have a cup of coffee, they go to the bathroom, they pee, so that urination is really fluid that's lost. So it doesn't contribute to it. So if you're out on a hot day, if you're golfing and you're trying to stay hydrated, drink iced coffee, it's really not a net gain for you. So you really need to drink water.
Got it. So those are great tips to get started with. So now maybe we can talk a little bit about some signs or symptoms that people should look out for if they're starting to get into trouble from the heat. So if you're outside exercising in the heat for a long time, just from my own personal experience, I go running. If I run in the heat, I start to feel certain things. Maybe you can start tipping us off on those things.
Well, some of the symptoms, I didn't want to stop you there. I wanted you to tell us about what your personal symptoms are, but the symptoms that are listed as heat exhaustion symptoms are headache, heavy sweating, a feeling of chills or cold or moist skin. The body actually starts to clamp down as we drop our blood pressure, becoming dizzy or feeling like you're going to faint, or frankly fainting. We often see patients in the hospital dehydrated and they faint. A weak or rapid pulse if you feel like your heart's racing, muscle cramps, fast, shallow breathing, nausea, vomiting are all signs of heat exhaustion. But I think the biggest and most common one that I hear people tell about, healthy young people, is headache. A headache is, I think, is a common sign that I hear a lot. So if you have these experiences, headaches or these other symptoms, feeling lightheaded, then it's really appropriate to say, hey, this could be the heat. Well, what do? Fix the primary problem, get out of the heat.
Are you in trouble when you're feeling those things, or is this more just a warning sign?
Well, I think that heat exhaustion is not the biggest thing. We're going to talk about the bigger thing coming up, which is heat stroke. Heat exhaustion is something to be mindful of. So it's a good warning sign. I think that you can pretty quickly turn around. It's certainly for a healthy person. Again, it depends who you're talking about. If it's someone who's frail, talking about someone who's got advanced cardiac problems, has congestive heart failure, is on a lot of medications, I'd say that this would be very worrisome, and I'd want to really quickly. I mean, most people have air-conditioned cars. That's an option. Like, get into an air-conditioned car. It's almost always available. Turn it on and just sit in the car. So I say get to a cool place and try to do what you can to drink plenty of fluid, water preferably, or some non-caffeinated beverage or non-alcoholic beverage, and just do simple things to get cool, like using cold compresses behind your neck, wiping your forehead, taking off as much clothing as you can to try to cool off, and stay in the air conditioning to try to recover. And I think that people generally will recover after a few hours. I mean, if you start to have the headache doesn't turn around in a few minutes, even after you do that. It takes a little bit of time.
So now let's say someone doesn't heed that advice and they keep going or what have you, and what's next? What happens if things progress? Well,
the next progression that people worry about is this problem called heat stroke. And heat stroke is where the body now is at such a situation where it's almost like losing fluids, such an extreme source of dehydration that the body's doing what it can to just maintain the body's functions. So we actually stop sweating, because now we don't want to even lose the water of sweat. We want to save it because we're dehydrated. So the body stops making urine, stops sweating, and the body has to sort of rapidly circulate our blood. So we have a rapid heart rate. People sometimes have low blood pressure, so they can become confused. They don't think as well. They can, frankly, lose consciousness. They can even get fevers because their body, it's not really like a fever, like a cold fever, but their body temperature rises because now they're not sweating, so the temperature starts rising. They become like a fish. They start changing their body temperature to their environmental body temperature. Again, nausea, vomiting, severe headaches. If people get to this stage, that really requires serious thought about maybe going to a hospital, getting an IV put in for hydration, getting actively cooled. If someone has really severe, we might have to use cooling blankets and a variety of other things. So that would be a serious issue, again, especially if someone is an older patient or has serious heart issues.
Why is it called the heat stroke? It's not a stroke per se that we think of in other realms, right? It's not nothing.
It's not a stroke like a brain having a brain heart attack kind of a brain attack kind of thing, but it's a terminology used.
Right. So this reminds me, actually, last year, this time of year, I saw a patient in the hospital who, older gentleman in his 90s, did not have air conditioning in his apartment. It was one of these days where it was 100 degrees and it was too loud outside, so he closed the windows, had his pajamas on, his usual full pajamas, got under the covers, and sustained a really severe heat stroke, came into the hospital with a temperature close to 107 even. It was in the 106s, I remember, and really damaged to his muscles, to his kidneys, really did enough, and turned around, but again, it had cooling blankets from head to toe, packing them in ice and everything. Really dramatic, and just very innocent in its beginnings, just going to bed for the night,
right.
And it didn't go so well.
Sure.
So it's a real issue, certainly. So I think maybe we'll shift gears. We've talked a little bit about overheating and the consequences of if it goes too far, but now maybe we can talk about how people can safely stay active in the summer and not and avoid these overheating issues.
Yeah, I think that one of the messages is that we talked in our winter session about how patients shouldn't use the excuse of winter to not go outside and do any kind of activity. Well, it's the same thing here. If being inactive and just staying in the house and watching TV and air conditioning is comfortable, of course, but we want people to be prudent and still be active. So I think those things that we already meant is certainly staying well hydrated. I think that we want to sort of continue the themes that we've talked about in many of our other programs about avoiding hydration that's rich in carbohydrates like sugar or corn fructose, which is what a lot of sodas are, or a lot of these fruit-flavored drinks that really aren't juices, but our fruit-flavored drinks are very high in sugar. So those kinds of things are really unhealthy. I mean, if that's all you have and you need to be hydrated, of course, take them. But I think there's a variety of things that people can do just to flavor waters. I mean, a lot of manufacturers have come up with flavored waters. People can do that themselves. I mean, it's not hard to, take a lemon and squeeze it into a pitcher of water and then put it in the refrigerator and enjoy that. You can put fresh mint. Mint grows in many people's gardens. Put that in water and just leave that in the refrigerator. I mean, other fruits, oranges, berries, melon can also be put to flavor, and all very low calorie, very taste good. So getting both families but children used to this kind of drinks are also healthier than getting them used to rich in sugar, soda. Those fruit drinks that I mentioned are really very unhealthy and have been shown, and we mentioned on prior shows how they're contributing significantly to the childhood obesity epidemic. So again, staying hydrated is important, but don't go off track on all these other things as well during these times. A second thing we mentioned earlier is the whole issue about the risk of sun. And you can certainly be outside, but wearing a wide-brim hat is certainly important to sort of protect our face and our eyes. Wearing sunscreen is really wise. Sunscreen with an SPF factor, sun protectant factor of 15 is recommended, and should be reapplied every couple of hours to try to keep our skin safe. That thing I mentioned, I would just like to mention again, that the 12 to 3 hours, really a time that, maybe that's the time to just go in and have a light lunch and get hydrated during those peak hours of really incredible hotness. Or, if you have the opportunity, you can sit in the pool or cool off some other way. Those are the hours to sort of just really take it more easy, the 12 to 3 hours. Sure. The dressing for heat, I think, is an important thing. I mentioned already, the breathable fabrics, the more synthetic fabrics, I think have been really a great addition to my personal collection of outdoor clothing.
I would add to that, too, especially from an athletic training standpoint, exercising in the heat. The old days of wearing cotton T-shirts where they would get drenched and heavy and hang off of you. Just no good. These light fabrics you're talking about, what a difference it makes.
Right, and I remind the audience, I know you know this, but I remind the audience that the way sweat cools us is by being able to evaporate. So when you basically take a wet T-shirt and stick it against the skin and you can't evaporate, you're not able to get the cooling, so it contributes to you getting warmer. Whereas if you want one of these fabrics that wicks it away, the water's continuously leaving, so your skin feels like it's dry, but it isn't. It's continuing to perspire and keep the body cool. And then, of course, there are a lot of indoor things that you can do that are active. There's people who have gyms. I mean, all these local gyms, we have dozens in our area. YMCAs are a variety of options to stay active but stay cooler are really wise as well.
Good. All right. Now, summertime, I think, I know from my own personal experience, and I'm sure yours, that there comes a lot of cookouts, barbecues. I have this conversation with my patients all the time. We're talking, there's chips everywhere. There's lots of, and this is not even a heat, summer-related thing, but what can we talk about, what can we tell our patients or viewers about giving them some tips at the summer barbecue on how to stay heart healthy?
Well, I think everybody in our practice knows that you are our culinary expert, and you've talked several times about cooking and cooking wisely. So tell us what your thoughts are. What do you tell patients, and what do you do with you and your family?
Well, it's a good question. So, I think there's a lot of options besides the old standbys of burgers and hot dogs. Everyone thinks of hamburgers and hot dogs or cheeseburgers and hot dogs. And there's a lot of other things that one can grill. So obviously, chicken is a simple thing, but I think fish is a great thing. I think it's ideally prepared on the grill. I really like grilled fish a lot. So that's another thing that people can do is grill fish. And vegetables, you can grill vegetables. You don't have to eat macaroni salad or potato salad every time it's full of mayonnaise. Lots of vegetables go very well on the grill, and very quick and easy and healthy and easy. There's things you can do as far as drinks. That's what I was getting at. Drinking, people, I think in the summertime often drink a little bit more alcohol-wise at barbecues and cookouts, and maybe cutting back on that a little bit. We know that more alcohol consumption leads to higher blood pressure and issues there, and so I think cutting back on that. What else? What else can we think
Well, I guess the
about
only thing that we haven't mentioned as you were talking, I was thinking about the vegetable piece, is that I don't think we've ever talked about it, but I know that you follow the whole food industry and issues about how food is healthier the closer the closer the table is to the farm.
Yes.
And in the summer, we have the opportunity to eat more local produce from, farm stands and from local farms, and from a variety of towns have farmers markets. So, and of course, it's wonderful because it tastes great because it's so fresh. They're very different than what we routinely buy in the grocery store. I think most people in our audience know that most of what we eat, especially in the non-summer months, comes from very far away, South America or other places. So it just adds to how healthy. It's not just better for you than unhealthy foods, but the good food is even better because it's local, I would say.
Yeah, I got to be honest, I have a hard time now going back in the wintertime and buying tomatoes at the grocery store when I've gotten used to the summertime local tomatoes. It's just night and day, the difference. So that's an issue. But what else was there?
So even you mentioned grilling, but we certainly would want to emphasize the value of making those really great snack foods. Fresh cucumbers from the farm stand cut up in a bowl at the kitchen table is a great snack. Fresh tomatoes. A variety of other kinds of things are really great snacks that we would encourage people to think about as a more healthy summertime eating option.
So what else here as far as snack ideas in the summer? You mentioned the cucumbers and the tomatoes and things like that, but some other ones I think you were going to touch upon.
Well, I mean, the only thing that, as you were talking about the grilling, is I remind people that another healthy way to cook that's also cleaner and it produces less heat in the house is to grill corn on the cob in the husk for about 30 minutes on the grill. So if you're out there anyways and you're making fish or hamburgers or whatever you actually are making, hamburgers, we'd say, we know they're part of a staple of American grilling, but try to use lean meat if possible. But I would say that the idea of again, fresh corn on the cob from a local farm on the grill for 30 minutes, just turning it, keeping it in the husk, and then husking it after about 30 minutes is another healthy way. And you keep the heat out of the kitchen because you're cooking outdoors, and it's easier cleanup. There's no pot to wash, so it's another great strategy.
Yeah, absolutely. Okay, what about water? Let's talk. We hear a lot about hydration, the importance of hydration. We've talked about it a few times already so far. Is there good evidence to back this up, or how much should we be drinking, or is there such a thing as too much or too little? So maybe tell us a little bit more on water.
Sure. Well, the topic is a very interesting one because there was a recent article in the British Medical Journal discussing this whole thing about how much water is appropriate and what evidence do we have. Like, can I say to a patient, look, the evidence, I like to be able to go to a patient and say, look, I know that this works. You should do this because if you do this, you have a 20% less chance of a problem. Don't have that with water. And many guidelines, the British guidelines, American guidelines, have recommended 8 glasses per day. But the British Medical Journal that I saw in preparation for our show today talked about how there really is no evidence for this. And there's a variety of things in the interest of just not spending a lot of time on it. Some of it is driven by some advocacy groups. One of the articles talked about there's a website called Hydration for Health, which actually is sponsored by a French food maker that makes the water Evian. So, of course, they're motivated to have us buy more water and think we all should be drinking 8 bottles of their water a day, which, of course, it would drive their sales. But there's really no data for it, and there's really no evidence that it prevents kidney issues or heart issues or anything. We know that drinking too little water, we've talked about the examples of how getting dehydrated is a problem, but what's the best way to do that? And many people have come back to say, if you just try to keep hydrated and you use thirst as a guideline, that would be really wise. We've seen, I think, many times people tell us that they drink more water and think that's a way to lose weight, that their stomach will be filled. But there's really no evidence for that. There's no evidence that it really makes you overall healthy. So I'm not advising people not to stay hydrated. But do you need to drink 8 glasses per day? The data is really lacking. So I would say a couple of simple things. Try to use thirst as a guide. If you're outdoors, I've told my dad, who's a golfer, who's out for 18 holes on a hot day for 4 or 5 hours, that a pretty simple clue is to make sure that you're urinating. If you're urinating, if you have to stop every few holes to urinate, find a tree, then that's a good idea that you are being hydrated. Because as I mentioned, we stop making urine when we're severely dehydrated.
And the color.
And the color of the urine is excellent also. So if you're using a tree, you may not be able to see the color, but if you're stopping on the between the back 9 and the front 9 in golf or some other time, the color of the urine, if we know that it's a lighter color, then you're well hydrated. as we are more and more dehydrated, our body's trying to save water, so the urine, the yellow color of urine, gets much darker. So if you see very dark gold urine, you're probably dehydrated. So urinating and a lighter urine indicates we're well hydrated. If you use thirst as a guide, that's probably good enough, but this is an area of controversy. You have any thoughts about that?
No, I was going to say, I think for most people, the average, relatively healthy people, I think it makes sense to just do what you said. Use common sense, use your thirst, go by how you feel, let thirst guide you. And it's not rocket science, you shouldn't overthink it. But there are some people and some patients we have with certain conditions that sometimes over drinking could be a problem. And so that's a whole other category. But I'd say for the average person who's outside in the summertime, don't overthink it. You're thirsty, you should drink. And I think the point of water is not just the issue of, I think water is a good choice also for other reasons of calorie avoidance and such when you're drinking, empty calories. You don't want to be wasting calories on fruit drinks and things like that. So I think water is a perfect drink for that reason. So there's a few other things I'd love to have touched upon, and I think you started to talk about it with skin cancer and insects and Lyme disease and all these other things, but we are starting to run short on time.
So I would just mention them that, people who are interested in them, there's a lot of resources on the internet, of course, about them. But skin cancer, 75% of skin cancers are basal cell cancers, which are sun-related. So I think, trying to avoid the sun for those people certainly who are sensitive to it, people who are certainly lighter complected or have a history of skin cancer in their family, wearing hats and wearing the skin covers. That's an issue. And then, of course, the mosquito issue. There are mosquito-borne illnesses. We haven't had them recently, but encephalitis, other kinds of things. So wearing DEET containing mosquito repellents are wise. And, of course, the tick issue on Lyme is also. So
it's a whole other show unto itself.
Which we'll have to find an expert to talk about.
Well, I do think we are out of time, so thank you. There was a nice change of pace compared to our winter talk. So we've covered the two major seasons here. So with that, I'll say thank you to our viewers for joining us. This was another episode of Matters of the Heart. It was brought to you by Pentucket Medical Cardiology as well as Haverhill Community Television. Thank you.